Hello, Ms. Carter. Can we start just with you telling me a little bit about your background and what got you interested in physical therapy?
Sure. So I've been a therapist for 30 years now. I started my career thinking I was going to be an outpatient orthopedic therapist and was very interested in the human body as a physiology major. And I went to PT school and I just became very interested in the whole body. And so I've treated all different levels and types of patients from acute care hospital to outpatient to geriatrics, traditional outpatient. So it's the benefit of being a therapist is you get a reward for every person that gets better. So it's a very satisfying field. And I've been doing this obviously a long time, and I like mentoring people to also make the patients better. So by extension, I'm a manager now. So I'm a rehab director. And so I've supervised up to, 30 therapists at a time. So it's by extension now. So that's a little bit about me.
Thank you. And so now moving on into what do you think the importance of physical therapy is, particularly for women?
So I think that we need to look at healthcare, like I said, holistically and not just look at it you know, as a single gender. There's definitely a appropriate way to treat a woman with post-surgical, perhaps, and think up as far as culturally too. So you just it's gender and culture that you need to be thinking about. I did a talk a while back to physical therapy students about generation differences. So you really have to look at how to approach a person in order to get the best outcome. Someone who is younger, from a younger generation, is going to react positively or negatively to an approach. So women tend to uh, be uh, they take care of others before they take care of themselves. So it's important to highlight that you need to take care of yourself too in order so you can take care of others. Does that
Thank
make
you.
sense?
Yeah, for sure. And then in particular, how do you think physical therapy is applicable to breast cancer patients? Because I feel like we always hear about surgery and that process, but not so much what comes after.
So the important thing about breast cancer, especially with surgery, is a lot of surgeons are just saying, okay, I did the fix, um, and go home, heal, give you a piece of paper, and a woman might go back to home and have all kinds of things to deal with. But they need to remember to do the mobility when they're cleared by their physician. So it really is a very simple process, but it still takes time in your day. So once you're cleared by your physician, which is typically, depending on the extent of the surgery, um, you want to start with some simple flexibility exercises within the pain-free range. And then once you have about a few more weeks after that, then you can do more active exercises. But it's compression as well is really important. They may or may not get a sleeve. So knowledge of preventing aggravation of swelling is actually universal to any injury. One of the biggest things that um, can delay healing is a lack of management of swelling. So pain management, swelling management, and then not not overprotecting the area. So it's Goldilocks. You don't overdo it, you don't underdo it. So like a simple educational, and that's why some of the doctors just don't think therapy is that needed for the post-surgical patient, because it's fairly simple, but it's something that you can do easily at home and encouraged to do.
Mhm.
Uh, and and you can have a progression. So if you ignore something and just power through it, you're either going to keep the inflammation process going and then delay healing if you overdo it. And if you underdo it, then you have the high risk of getting adhesions or scar tissue in places that you can't afford to have, because arms, right? You need to raise your arms up. So it's just doing a simple range of motion program, first assisting yourself, and then next phase, going ahead and raising your arms up and making sure that you've got the stretching going. So these are not extremely complicated processes and complicated exercises, but I think the knowledge base just isn't out there. And people are just saying, okay, surgery's done, come back in 4 weeks, or don't, surgery's done, and, do your best. So flexibility and strength, and just giving yourself the permission to take care of yourself is really important.
Mhm. And then you covered this a little bit, but in case you had anything to add, my next question was about really how much, just for informational purposes, for anyone watching this, how much is too much?
The risk is, uh, if you overprotect, the risk is scar tissue.
Mhm.
Everybody understands scar tissue, right? And that means you can't move your arm, you can't get dressed the way you want to, you can't get your bra on. Um, the if you don't take care of the swelling, right? There's two types of swelling. There's just regular swelling, like you sprained your ankle and your body has an inflammation response. Well, with breast cancer, there's something that can happen that's called lymphedema, and that's when they have to remove the lymph nodes, because there might be cancer in that area, and that's part of the plumbing, where the lymph takes the fluid and it brings it back to the heart. So that keeps the fluid out of your, in between your cells. So breast cancer patients have a really high risk of getting lymphedema. And the best thing that you can do for lymphedema is compression, just really light compression, not a firm touch at all, because these things are like, they're like floppy noodles, like really floppy noodles. They're like that. They're very delicate. So it doesn't, you push a little bit too hard and you just block the whole thing. So it's almost like feather touching that you can do with your arm. Um, and that's called lymphedema management. But for someone who just came from surgery, they an ace bandage or a garden glove or something simple to put um, the the pressure on. So the biggest thing that can happen, that I strongly encourage a woman to go back to the doctor, is if they see the swelling in the arm. And so and the risk of overdoing is like that pain and protection, overprotecting, and then lack of healing. So Goldilocks, right? Getting right in the middle of,
Yeah.
you want to just enough to keep your flexible and strong, but not so much that you're causing an inflammatory response and more pain. So pain-free range, pain-free exercises is the most important to tolerance. Okay, if someone just had surgery, of course there's going to be pain. Tolerable. Okay, so it's navigating the medium, navigating that safe zone. That's the thing that women can do to help themselves the best, because we tend to overdo it, more than we underdo it. But if we are also fearful, you can underdo it. And you don't want to, you do want to give yourself permission to work your body. Your doctor's going to tell you when the stitches and or anything that needs to be protected. The doctor's going to give you very clear instructions on when to start moving. Okay, so that's under the doctor's decision. But when you do get that clearance, it's time to move because you need to have function and then strength. So you get the healing, pain management, flexibility, function, and then build the strength. That's the sequence.
Mhm. And then, how do you think this information, what you just described, the importance of rehab, how can it be made accessible? Do you think virtual videos are a good tool for this? Are there any other ideas that come to mind?
I think that having simple videos is basically, I think, the future of how people are going to learn. That's the majority of how people receive their media now, is in small, easy to understand, visual, very few words, maybe a little bit of instructions on the bottom. Uh, Most people don't have a lot of time. And for me, if I've given patients a list of 7 exercises, I know 0 will get done. If I give a patient 2 or 3 exercises, they have a chance of doing them
Mm.
because everybody has a busy life.
Yeah.
So it needs to be small, it needs to be easy to understand, and it needs to be, within a media that is accessible.
Okay, thank you so much. Did you have anything you wanted to add that I didn't cover with my questions?
No, I think that this is the only thing I can say is keep it simple. And then you'll have a higher chance of, I'd rather have a patient do 1 or 2 good things that are helpful to them a day than assume that they have to do everything.
Yeah.
So, do what you can do and focus on the right phase of your healing. Because if you do go to phase 3 when you're in phase 1, that's not helpful. So you got to know where you are in your healing process and then work on that uh, target goal. Okay.
Okay, thank you so much.
All right. Have a good day.
You too.